A recent example of a patient that I took care of who had EBMD and significant cataracts was a patient from one of my rural clinics. And this patient had very dense cataracts. I would grade them at 4+. But she also had very significant EBMD. She had the type where you have fingerprints that are coming down right through the central axis. And on her IOL master, she actually had upwards of 4 diopters of SIL in one eye and around 2.5 diopters of astigmatism in the other eye. This is a patient who would have been happy no matter what we did. If we just did the cataract surgery, she had such dense lenses that she would have noticed an improvement. She was also someone who was very hyperopic and had always been used to wearing glasses her whole life. So the easy thing to do potentially would have been just to do her cataract surgery. She probably would have been happy, dealt with her refractive errors afterwards, giving her glasses, and she probably would have been relatively happy. But I knew there was something better I could do for her. I knew that there was a premium outcome potentially waiting for her if we took our time and did something extra. And so I spent some time educating her. And I told her that she has 2 problems, not just cataracts, and she has this problem called EBMD. And so we went ahead and did the keratectomy with PROKERA ring afterwards. We did one eye, let it heal. We did the other eye. And it was amazing to me when she came back after the second keratectomy. She told me that she couldn't remember how long it had been since she saw that well. And this is still having 4+ cataracts in her eyes. Her visual acuity had dramatically improved, not great, but she was somewhere around the 20/60, 20/70 mark at this point. Her astigmatism had been reduced by over 2 diopters in both eyes. We then went ahead and did the cataract surgery, and I don't know that I've ever had a patient more grateful that I took my time with her. We didn't rush her into cataract surgery, that we actually were willing to go that extra mile and provide that extra little bit of tender loving care that sometimes patients think that we as physicians have forgotten. So it was a really special patient for me. It's a learning point for me as well. It reinforces that doing the right thing always will lead us to the right result. And so for her and for me, it was very rewarding.